Tip Friday.
Hello, everyone, and welcome to another special edition of Fit Tip Friday. Once a month, I will be interviewing wellness professionals on various health-related topics. I'm very pleased to welcome my guest today, Dr. Mark Kasiban. Dr. Mark is a family chiropractor and has been in practice in the Durham region for over 17 years. Over the years, he has helped countless families be healthier, from newborn children to seniors, and also athletes at the collegiate and professional levels. Dr. Mark completed his undergraduate studies in occupational therapy at Queen's University and received the Doctor of Chiropractic degree from the Canadian Memorial Chiropractic College, where he graduated magna cum laude and clinical hours. Also, he has taken postgraduate courses in pediatrics, prenatal care, and sports performance. Dr. Mark's focus is on helping families be as healthy as possible through chiropractic care. Welcome. I'm so glad that you could join me today for Fit Tip Friday. So I'm going to start by asking you, can you tell us what are the benefits of chiropractic care?
Well, first of all, thanks for having me today. I'm really excited about being here and, sharing how chiropractic can benefit, people in our community. So I think one of the biggest things, chiropractic has really done really well with helping people with things like back pain, neck pain, headaches, even obviously sports injuries and car accident injuries. But I think that really one of the biggest things that we really focus on more so is on the nervous system and a properly functioning nervous system. So what do I mean by that? I really want to help people understand that chiropractic is about helping the body heal from within. And I think a lot of the practitioners that you've brought in, which I think is awesome, have really talked about trying to help healing from within, looking at things at a holistic approach. And so while we're obviously concerned about people that have, aches and pains and wanting to help them, live their lives as best as possible, our focus is really on helping people's nervous system function optimally. Now, for some people, they might be like, okay, sounds good, but what does that really mean? And so I'll go back to a little bit to you remember back in the day, grade 10 biology or grade 11 biology. And, the nervous system is so important because it comprises of the brain, the spinal cord, and the nerves, which controls what? Everything. And so for our heart to beat, for our lungs to breathe, for a cut to heal on our arm, basically the brain has to be able to communicate to the body and the body has to be able to communicate to the brain. So what does this have to do with chiropractic is that what protects the brain and the spinal cord and the nerves is the skull and the spine. Now, let's face it, if everything was flowing properly, we wouldn't be here, right? We wouldn't be talking about chiropractic because the reality is the body would be functioning and healing and repairing the way it's supposed to. But unfortunately, nowadays, especially, our spine goes through a tremendous amount of stress, right? We talk about people working on computers, people on their phones, and it puts stress on the spine, right? So when the posture's off, when the spine misaligns, when the body doesn't move the way it's supposed to, it can actually put stress on the nervous system. So which means that the brain does not communicate as well to the body and the body cannot communicate properly to the brain, which means that it affects how the body functions, heals, and repairs. So I think that's really what chiropractic is about identifying areas in the spine that is misaligned or not moving as well as it's supposed to, and allowing the nervous system to flow properly. And when the nervous system is able to flow properly, the body is able to function, heal, and repair the way it was designed to. So I think that's really my long explanation. And I think, for some people, they'd be like, okay, that sounds great, but how does this really impact me? And I think it's our everyday lives. We're put through so much stress in our bodies each and every day, especially over the last couple of years, let's face it. And because of that, I think a lot of people are experiencing neck pain, headaches, but I think also people are noticing things like, their energy is not right. Maybe they don't sleep as well. Maybe their digestion's off. And what we found is with, a lot of our patients is that when we're able to correct, maybe they were brought in because of back pain, maybe they came in because of neck pain, but it's pretty cool because those same people, they say, Doc, you know what? I noticed that I'm sleeping better. I noticed that my digestion's better. I noticed I'm breathing better. Is it that connection thing that you kept talking to me about? And I said, yeah. And it's so cool to see how when we're able to take some of that pressure off, the body just does what it's supposed to do, which is it heals and it works better. Mm-hmm. So that's kind of my totally long explanation as to, really the biggest benefits of chiropractic care is allowing the nervous system to work properly and the body just works better.
Yeah. Mm-hmm.
Yeah. So, yeah, sorry for the long explanation. I just, I think it's just really important to help people understand how the body works and how chiropractic can help their body work better.
That's a really good point, because you're right. A lot of people don't correlate that, is the noticing from like proper care, clinical care, noticing some of the other little things that improve, like you said, like your sleep, like your energy. That is a really good point. I don't think people correlate the two. It's the same with exercise as well, right? People have their goals, right? And we know as trainers, people have their goals. I want to do this. I want to get my strength, or I want to lose weight, or I want to whatever, but they don't notice, I feel stronger today. I can run up the stairs without getting winded. Wow, I did my gardening and I had no back pain. So I really understand that point. And that's great that that is in chiropractic care as well, because I don't think a lot of people thought of that. So
no, absolutely.
That's awesome.
So when we explain that to patients, they say, oh, well, that makes a lot of sense.
Yep.
And, it's pretty amazing when people start to see these other health benefits as well. And then they say, I wish I had started this before, because if I really understood what, chiropractors did, I would have been doing this a long time ago, which is, it's such a simple concept. And when people understand it, it's pretty cool to see how their health improves.
Absolutely. So, which takes me to my next question. Mm-hmm. What are some of the misconceptions of chiropractic care?
I think there's a ton, unfortunately. And I think it relates back to what I was talking about earlier. It's more of just informing people, in generally our community. I'm not so sure we have done a great job communicating as well and educating the public about the benefits of chiropractic care. And I think sometimes when we don't explain it, maybe as effectively as we can, this is when the misconceptions start to happen, right? So I think one of the ones that I get is the, I don't really want the cracking of the back thing, or, and let's face it, we're not breaking backs, we're not cracking backs. From a physiological standpoint, it's just air released from the joint. Having said that, we do have a multitude of techniques that we do to do the chiropractic adjustment, right? So the chiropractic adjustment is meant to reduce the pressure on the nervous system. We can do it manually. And when we do it manually, sometimes you'll hear that popping noise. But we also have, we have an instrument, and it's like a spring-loaded clicker, and it clicks on the bone, and it's very gentle. It doesn't making that really, big noise. And so for some people, that's more ideal for them. So we have different techniques. We also have tables that move a little bit We call them drop tables. You're not actually dropping. It just moves down, up and down a couple of millimeters, couple centimeters to help achieve the adjustment. And, I think another misconception along with that is it going to hurt or, and listen, you know what? When we're making changes, sometimes people can feel sore, when they're first getting adjusted. That's the minority though. Okay. Just like, it's just like working out for the first time in a long time. We're moving things that haven't moved. You might feel a little achy, nothing to worry about. But most people feel awesome afterwards because we're moving things that haven't moved before. Now they're noticing like better range of motion. Like I said, it also decreases the stress response in the body. So they might notice that they had a really nice, good sleep, after their first adjustment. Most people feel awesome. Unfortunately, for some people who, maybe are really, really rigid and stiff, it might just feel achy just for, maybe a day or so, and then they're back to normal. Mm-hmm. So I think that's one of the other misconceptions. I wrote down a couple here. So I guess I'm going to go along with that is about safety. I see, I think I mentioned, or you mentioned on the bio about pregnant moms. I see babies, I see young children, adults, and obviously seniors. So it's a safe procedure. We wouldn't be doing it, obviously, if people, were not getting well from it. So everyone's a little different too, right? So I wouldn't adjust a baby like I would an adult. So we modulate, the amount of force that's required to do the adjustment, depending on your size, depending on your health. So all of that obviously is considered when we do the adjustment.
So it's personalized to the individual really as well.
Absolutely.
Yeah.
I mean, I always tell patients that, and I think this is similar with personal training too, where, listen, I'm learning you. I'm going to be learning you and how your body responds. So let's communicate. If you found that this, maybe you weren't getting better as quick as we want, then we talk about that. Maybe we do need less force. Maybe we need more force. Maybe we got to talk about certain exercises, maybe a certain lifestyle. So we're always working together to figure out what's going to work best for you, what's the best adjustment for you. And even those things change as you improve, right? So I think that's one thing too, is that sometimes people forget that we're also focusing on them and that everyone is going to be different in how we provide that care for them. Some people are quicker, some people are, it takes a little bit of more work to help them. So the other thing too, I've had this before where chiropractors aren't real doctors. I've heard that one too. I think when I was a new grad of 17 years ago, I almost got a little offended by it. But if you're talking about being a medical doctor, no, we are not medical doctors. But there's different types of doctors, right? There's optometrists, there's dentists, there's PhDs, there's foot doctors. So we receive a doctor of chiropractic, and our education is quite intensive. We have to do 3 to 4 years of undergraduate study before even being able to apply to chiropractic school. And then we do another 4 years of, schooling of intensive study into different sciences. So things like biochemistry, anatomy, physiology, neuroanatomy, neurophysiology, you name it. So very similar to our medical colleagues, but obviously it focuses more on the manual aspect of things, more than natural therapies. And then we do a year of clinical internship. So, that's our expertise. It's a little bit different, but there's a lot of overlap, and we learn a lot of things to be able to also refer to our medical colleagues and different health professionals that are experts in what they do. So I think those are some of the misconceptions that I've encountered over 17 years. And those are the ones I kind of address more regularly and able to just communicate some of those, communicate those things.
Yeah. Yeah, that's amazing. I know it's not cracking. I was always told that. It's called an adjustment. It's not cracking.
That's right.
So I
That's
always tell
right.
people that.
Yeah. And I think it's, I think people mean well by it. I don't think they're necessarily putting a negative connotation to it, but I think also it doesn't reflect obviously what is happening. And, when we do the adjustment, I talk a lot about the nervous system, but it's also
Yep.
about mobility too.
Yep.
Right? So when your spine is stiff and it's rigid, the adjustment helps improve the mobility within the specific joints of the spine, to help prevent, future breakdown and obviously improve range of motion. So
Yep.
at that very level, it's helping people just be able to move better.
Yeah, that's amazing. So what would you say would be the most common reason people come to see you initially?
Initially, I think, one of the things that I mentioned at the beginning, it's the low back pain,
Yeah,
it's the
that's what I
neck
thought.
pain, it's the headaches. You know, and I think it's fantastic because they're able to, it's unfortunate. I think sometimes people come to us as a last resort. They may have exhausted the various things and we're like the last resort. And I don't mind that from a standpoint. At least they're going to be able to get help. You know, let's face it. A lot of those. When we talk about like the Tylenols and the Advils, when you hear people having to rely on those things, they're constantly really focusing on symptom relief, and I think that's you know they have their place, right? Like if you have a headache today and you weren't able to do this interview because of the headache, well, it makes sense for you to take the Tylenol or the Advil to help you get through and be able to do today.
Mhm.
The problem is if you had to do that every day and you're popping them like chiclets every day and we're not addressing the cause of the problem, I think that's when we really got to reflect as to what's going on with our body, right? And I think I see that, like, we're going to talk about maybe the details of what I see. I see a lot of that, you know. I notice sometimes when I have patients come in, particularly my female patients, I'll hear their purses, I'll hear the rattling of the pill bottles, and it's sad sometimes because people are relying on that just to be able to get through their day. So I think for me, it's such a blessing to be able to help people address the cause of some of their issues, through the chiropractic adjustment, but also addressing some of those lifestyle changes that we need to talk about, like proper posture. And, we talked about yesterday, I think when we ran into each other was, people are sitting at home all the time, would be, working and it never stopping, right? Because they got their phones and they got their computers there. And I think it's really important that people move, people. I'm kind of going on a tangent here. But I just think that one of the things as a chiropractor, I tell my patients every 20 to 30 minutes, get up and move. Get up and move. Break up this static cycle of sitting. It doesn't matter really. I mean, I think the trend has been, working from home. People are worried about their chair, their desk. They want to get the stand-up desk, they're all great things. But if you're standing or sitting in a perfect posture for hours on end, there's still a stress on your body, right? So we got to get moving. And that's where, getting a personal trainer, exercising regularly, eating right, all these things to address a lot of these health issues that we're dealing with from a sedentary lifestyle, we need to be doing. So that's my health tip, I guess, would be for some of your viewers, Sherry, is get moving every half hour. If you're working, sitting down all day, get moving, even if it's just a minute, right, Sherry? Like breaking up that cycle is so critical, just to allow the muscles to be moving. Everything is just flowing properly, right? So
Absolutely. You can tell when you've been sitting for a while and you get up. I mean, myself anyway, it's like, oh, I can always tell if I've been sitting too long, but you're absolutely right. We've got to move. I love your whole wellness approach. I'm sure that you've given a lot of information to my viewers on my Facebook page. And anything else you would like to add before I think the information has been outstanding. I learned a lot myself personally, more about what a chiropractor, the role of a chiropractor and how a chiropractor can help us in our everyday life. And fantastic information. I really appreciate it.
thank you. Thank you. I was absolutely honored to be in this interview today, and be a resource for your viewers.
Thank you so much for joining me, Dr. Mark. And what I'm going to do, I will be leaving Dr. Mark's contact information, his clinic information, when this is posted. So if you want to contact Dr. Mark directly, you absolutely can. And he's also agreed to be an expert on SC Wellness Solutions Facebook page. You can also direct any questions right to my Facebook page. So thank you, everybody, for joining me today. And again, thank you so much, Dr. Mark. Appreciate it.
Fit Tip Friday.